Okay, good afternoon, everyone, and thank you for being here today as we announce an innovative, major structural change to the Lackawanna County Department of Human Services in concert with an exciting new focus for the children and families in our community. I specifically want to thank, before we get started, our Chief of Staff, Brian Jeffers, our Communications Director, Pat McKenna, our Human Services Director, Acting Director, Barb Durkin, attorneys Dan and Pat Breyer, our consultant, Bev Macrith, and many, many, many others who helped us along this way. We are confident that the groundbreaking plan we're presenting today will produce a much brighter future, not only for the Office of Youth and Family Services, but more importantly, for vulnerable families and children in Lackawanna County. We have the ability to create a statewide model for family and youth services rooted in prevention rather than in reacting to crisis after crisis. To understand the elegant solution that we have devised through countless hours of work by in-house staff, consultants, and our supportive state partners, it is important to understand the major underlying problems. When Commissioner McGloin and I took office on January 2nd, just over 4 months ago, we faced separate, seemingly intractable problems regarding the Office of Youth and Family Services and the new, but as yet uncertified, Department of Health. The problems differ in origin and scope, but as we worked on both, we came to realize that resolving one could go a long way toward resolving the other. Let's begin with the Department of Health.
The department was born amid the throes of the COVID-19 crisis. One of the problems that arose during that period was the lack of a mechanism to collect the relevant data regarding the disease's local impact beyond death statistics collected by the coroner. The creation of a local Department of Health was a reasonable idea to respond to the COVID epidemic. Local state legislators, led by Senator Marty Flynn, were effective in securing a $4 million rescue plan grant through the State Department of Community and Economic Development to acquire the former PenFed Credit Union building on Franklin Avenue. The county began exploring the development of a health department in July of 2020. It developed a departmental plan and county health assessment and received approval to proceed from the State Department of Health in March of 2021. Afterward, the county took preliminary steps such as appointing a board of health and an agency director. It also hired the staff that would be required for the department to receive state certification. Today, the department has 26 employees and an annual budget of $4.7 million. Unfortunately, the urgency to create the department resulted in the lack of the sort of long-term financial planning that normally would precede the creation of a freestanding county government department. The department was developed under the assumption that the state government would reimburse the county for about 80% of the Department of Health's operational costs, but there was no feasibility study done to test that assumption.
An 80% reimbursement would cover more than $3.75 million of the department's $4.7 million budget, but we quickly discovered, after taking office, that the assumption was unfounded. We contracted the Scranton law firm of Myers, Breyer, and Kelly to conduct the comprehensive due diligence that Commissioner McGloin and I required before committing to full state certification of a Department of Health. That investigation revealed that the actual state reimbursement would not be 80%, but a maximum of $6 per county resident. That would be about $1.3 million that the county could apply against the health department budget of $4.7 million. That is only about 27%. But the investigation also revealed that the counties that have state-certified health departments rarely receive the full $6 per person. The highest that we found was $5.15 in Bucks County. At that rate, Lackawanna County would receive a reimbursement of approximately $1.1 million, or about 23% of the department's annual budget. Reimbursements fluctuate based on levels of offered services, so they are hard to compare. But as this slide behind us demonstrates, county taxpayers would face enormous costs in funding the department. It's also important to keep in mind that when Commissioner McGloin and I took office in January, we were faced with $19 million in unpaid bills and a $15 million structural deficit. We have a responsibility not only to taxpayers, but also to children and families. In sum, it quickly became apparent that a freestanding county health department is not sustainable for the long term. Therefore, we have decided not to submit an application for the health department certification to the State Department of Health. This decision will save county taxpayers tens of millions of dollars over the next decade.
That does not mean, however, that Commissioner Gaughan, myself, and this administration has abandoned a strong commitment to public health. As you will see when we discuss our innovative new program, we will give our public health efforts a much sharper focus to address a pressing public health crisis that, unlike the COVID crisis, has not abated. And we are pleased to report that the change in focus does not jeopardize the $4 million in state grant money that was used to acquire the Franklin Avenue building, which we are continuing to use for other county purposes. The single tax office, for example, remains in that building. Now let's turn to the Office of Youth and Family Services. As you know, the office has been operating under a provisional license since May of '23. And as you know, several caseworkers and supervisors were charged criminally last year for alleged failure to adequately protect at-risk children. Those charges were dismissed by Lackawanna County Judge James Gibbons, but the District Attorney's Office has filed an appeal, so we cannot comment further on those cases as they remain under litigation. Our OIFS office is badly understaffed with at least 50 unfilled positions, and morale has suffered. Even as dedicated caseworkers and supervisors have struggled to reduce a major backlog of referrals while providing services in confirmed cases, new referrals have continued to pour in. Largely due to the staff's tremendous dedication, we have made some progress. Since January 2nd, we've added 5 new full-time caseworkers and have approved 6 part-time positions to help relieve parts of their workload, allowing caseworkers to spend more time on providing direct services.
A few weeks ago, I had the opportunity to spend a day with a caseworker from the Office of Youth and Family Services. I saw firsthand the challenges that they face, the long hours, the overwhelming and complex cases that come in every day, and the toll that it takes on them and their families. I also got an up-close look at the struggles of our children and our families and what they're facing in our community. As a father of 5 children under the age of 8, it broke my heart to see and hear some of the unimaginable things our children and families have to endure. Our best hope for the future is our children. They are our most valuable resource, and they should all have the equal chance to develop their talents. It was clear to me after that day that we faced immense challenges, not just as county commissioners, but as a community and as a society. Where there are challenges, there are opportunities. We have become convinced that the answer to these problems does not lie in wrestling endlessly with the system as it currently exists. The scope of the problem, not just the important regulatory matter of restoring the office's full license, but meeting the health and safety needs of the at-risk children and families that the department serves, left no doubt that a new approach was necessary. We hired consultant Bev Macareth, a former State Secretary of Human Services, to help find a solution. She has worked diligently with our Human Services team and their counterparts in Harrisburg, examining the immediate long-term needs of the County Department of Human Services. The result of all these efforts is the innovative program that we are announcing today, an elegant solution to the problems we have described regarding the Department of Health and the Office of Youth and Family Services.
We will create a public health model of prevention for at-risk families and children. Lackawanna County will become the first county in Pennsylvania to operate its Office of Youth and Family Services under a Family First Prevention Plan in partnership with the State Department of Human Services. The Shapiro administration has been very supportive of our new model and continues to work with our team. To help reduce the backlog, the State Department of Human Services has approved our proposal to provide overtime for OIFS assessment staff, to hire former OIFS staffers to assist in screening, to enlist and train staff from other Lackawanna County agencies, and to pay overtime to certified OIFS staff from other Pennsylvania counties in an all-hands-on-deck effort to reduce the referral backlog.
We also have asked the department to approve new funding for our innovative new approach. We will have a Family First Community Pathways model for family support and prevention services, the first of its kind in Pennsylvania. This model allows us to redirect and refocus resources that were allocated for a freestanding health department to address crucial public health prerogatives affecting families and children, including violence prevention, child maltreatment, housing, maternal and infant health and safety, and more. Community-based providers, rather than the county government alone, will work with families to provide the help that they need to safely keep children outside of the child welfare system, unless that early intervention proves to be inadequate. To facilitate this public health focus regarding child welfare services, we have offered many County Department of Health employees the opportunity to work within the Family First Community Pathways Project. This innovative transformation was made possible by the Federal Family First Prevention Act with the strong support from Governor Shapiro's administration. It seeks to treat child welfare as an urgent public health matter, prevent the placement of children in foster care, promote family stability, and improve overall outcomes for children and families. The U.S. Department of Health and Human Services approved Pennsylvania's participation in this program less than a year ago.
During this process, we're proud to say the focus of everyone involved, our staff, our consultants, our state and community partners, has been on ensuring that vulnerable children and families in Lackawanna County receive the help and services that they need to succeed. The Family First Community Pathways program that we have devised provides a sound structure to do that, and we are eager to get started on this innovative, groundbreaking, community-based public health approach to better serving our kids and our families. We will now take questions if anyone has any.
Thank you. You guys mentioned 26 employees of the health department, and you also mentioned that several of those will be offered employment in another capacity for the county, under this project that you announced today. Were they laid off? I mean, what's their employment status as of now?
So we have asked them to, if they are interested in this new model, this new structure, that they would express that interest in writing to our HR department prior to the end of business tomorrow. They will be paid through the end of the next pay period, which is May 21st.
Okay. So they were laid off, and they have the opportunity then to express interest in those positions.
Correct.
This is a shift. Right, shifting all our focus and our attention to what has been for quite some time now a massive emergency here in Lackawanna County. Jeff, and as you, Chris, and others know, since January 2nd, this has been a priority for Commissioner Gaughan, myself, our Chief of Staff, Brian Jeffers, and the rest of our administration to get a hold of this, to get a handle on this. So we look at this as almost a shift from here to here.
Yeah, excellent. And can you guys just kind of talk about, how this model is going to function practically? Like, how, you're talking about prevention as opposed to reaction, which I think is a sound kind of philosophy to embrace. But how is that going to work?
So last year we had over 4,000 general protective cases, referrals come through the door in the Office of Youth and Family Services. With the fact that we have a huge problem with staffing, it's not sustainable. Mm-hmm. So not only are children and families not getting the services, but there's a lot of them that are probably falling through the cracks. Out of that 4,000, what Bev Macrith and others have discovered in looking at the cases is that there's probably quite a few that don't need to get sucked up in the child welfare system. Mm-hmm. Instead of having a caseworker knock at their door, they need to be redirected to community providers that can help them with whatever they need, different things, whether it's for their mother, reading, literacy, all down the line. So we want to try to redirect those families out of the welfare system, out of the child welfare system, and into community providers, which I think could be more helpful to them in the long run.
And last thing for me, you guys mentioned the almost $5 million budget that was the health department budget. In kind of shuttering the health department concept now, those resources will be redirected largely or in full to this new model that you're talking about now.
So the funding mechanism for what we're doing is a lot more stable and predictable than it is under the Department of Health. Mm-hmm. And that is where we're going to save money over the next 10 years. I mean, if we stuck with the Department of Health, we're laying out millions of dollars every year, and we're not quite sure how we're going to get reimbursed. So this is a much more stable way of budgeting, to be quite frank. And we're also trying to solve a problem that exists. And as I said earlier, we could have just said, let's do whatever we can just to get the license back. Mm-hmm. But when I went out with that caseworker, we have serious problems in Lackawanna County. We have problems in the community. We have problems as a society with our children and our families. So we really wanted to put our heads together with the team that we have here to figure out is there a different way that we can address this instead of just kind of plodding along and trying to get the license back?
I think this offers a fantastic opportunity for us for grants funding. And as Commissioner Gaughan had just mentioned, and as everybody here today is aware, our employees within that department are tired, they're emotional, they need help. They can't continue to survive and work in the environment that they've been working in. And I know we mentioned we have made a few hires and approved some part-time positions moving forward, but it just isn't enough. So I'm really proud of the department, the way they've kept it together, the way they've rallied, the way that they've worked night and day. Barb, the job that you've done, Bev, and everybody else, this has truly been a tremendous team effort. And we're certainly excited about what this could potentially hold for the future of Lackawanna County.
Appreciate it. Thanks.
It's refreshing to hear someone in government use words like emergency and urgent concerning this issue, because it has been obviously an emergency that's been going on for a while. I'm interested in if you could talk more about the apparatus itself. You're talking about all hands on deck. There are going to be other, I guess, non-governmental agencies involved. Some other, how will that be coordinated?
So the first part of this plan was submitted, The first part of this plan was submitted last week. Are you talking about the overtime and how we're going to try to get caseworkers from across the state to help with the backlog?
Right, no, I mean, going forward, like how is this Family First Community Pathway is going to operate?
So we're still working on what the structure actually looks like. We submitted the proposal to the state this morning. But basically, the way that I like to think about it, Matt likes to think about it, is kind of what I said before, that there would be a team of public health professionals like we have in the Department of Health that their sole focus would be on redirecting these families, not to the child welfare system unless they really need it, but to community health providers. And I'll give you a quick example. Let's say that there's a referral from someone in the community about a child, and let's say that it is a behavioral issue or parent-child conflict with children with no injuries. Does that family really have to get sucked into the child welfare system and have a CYS caseworker knocking on their door? Or do they need this new office and the resource navigators that we'll have to redirect them towards a community provider that's able to provide them with mental health support, parenting classes, things like that? Because the issue we have now, quite frankly, is if a CYS caseworker is knocking on their door, the chances are it somehow is going to fall through the cracks. We have a backlog of over 700 cases. So the first part is trying to clean that backlog up. The second part is let's rethink how we approach child welfare in Lackawanna County.
Right. It's a commendable goal. I'm just wondering how about that's going to take a lot of coordination.
Yeah, it's going to take a lot of coordination, but we're confident because we've had great conversations with the state. We've had great conversations with Barb Durkin and some of the other community providers in Lackawanna County that this will be successful.
And I like to think too, and I know timing is a very important and crucial issue when it comes to this, but it's taken us, I like to think rather quickly to be able to build this and put this together. So that'll continue to be our approach moving forward, is fast, urgent, all hands on deck.
Hello. I just wanted to clarify that you said 26 employees had been hired by the county for the Department of Health?
Correct.
Okay. And what will this do with the license? You still have the provisional license?
We do. We still have the provisional license. We're not quite sure what effect it will have. We hope that it will move us in the right direction to get the full license back, but we're not quite sure what effect it will have. Anybody else?
Sure.
Thanks. So is there any timeline on how soon this could, I know it was submitted this morning, but how soon it'll actually take effect?
We don't have a timeline yet, but as Commissioner McGloin said, we're moving as quickly as we possibly can. So I'm hoping as soon as possible, but I'm hesitant to give an actual drop-dead date.
And like everything else, when we know, you'll be the first to know.
Okay, thank you.
Yeah, sure.
Thanks. Just following up on that question, so you guys submitted this plan for approval today. It's pending state approval, but this is, I know you said you had some productive, fruitful conversations with the state about this, and they're supportive. This is technically still pending approval by the state.
Correct.
Okay. Thanks.
Any other questions? Okay. Thank you, everyone. We really appreciate
Thank
it. Have a great day.